Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bower, the editor of GP Online. On the podcast today, I'm joined by our deputy editor, Nick Bostock, and later on we'll be joined by our senior reporter, Kimberley Hackett, to talk about some of the latest news affecting general practice. Today we're talking about how much GP partners are earning after figures for 2022-23 were published, as well as the uplift to this year's GP contract and what that could mean for GP partner pay this year. We're looking at a report from the Tony Blair Institute, a think tank set up by the former Prime Minister, about AI and the NHS and what that had to say about general practice. And we're talking about a landmark legal ruling last week that overturned current rules for RCGP exam resits for GP registrars who are disabled. Our good news story this week is about a group of practices who are downsizing their PCN. That's all to come on this episode of Talking General Practice. So first up, let's talk about GP pay. So last week, NHS Digital published data on GP earnings and expenses for 2022-23, which showed a significant fall in GP partner income for that year. Nick, can you explain exactly what this data is?
These are figures published annually by the NHS on earnings and expenses for GPs across the UK. And they're based on tax data from HMRC. So this is information basically from GPs' tax returns. And for each UK nation, these figures present information about things like gross income, income before tax, expenses in a specific tax year for GPs, covering partners and salaried GPs separately, and then a combination of the two. The data are broken down in various different ways by country, as I mentioned, but also by practice size, by rurality, by GP's age, and so on. And then there are estimates of how GP income compares with previous years, both in cash terms and in real terms, so factoring in inflation. And there are some really significant caveats with the information they present, though, which means that the picture they offer of GP income is really not that straightforward. So because they're based on tax returns, the figures don't differentiate between income from NHS and non-NHS work. So they aren't purely a reflection of what GPs earn from working as NHS GPs. These figures also don't differentiate between doctors working full-time or less than full-time. So the first of these caveats could push up the true picture of GP income, while the second one potentially could drag it down. Add to this what we know about the number of hours GPs actually work. GPs who are counted as working part-time can in fact be working well over what would be considered full-time in any other job, and it all looks even more complicated. So what this means is that overall, the figures are really just a crude measure of whether GP income is rising or falling, not so much a proper picture of what GPs actually earn. And for that reason, actually, I'm going to talk in terms of percentage changes and not go into the actual amounts that they talk about. And if anyone wants to find that information, there's more about that on our website and on NHS Digital's website. But despite all this, these figures are part of what the Doctors and Dentists Review Body, the independent body that advises the government on doctors' pay, uses to shape its recommendations each year. So they are genuinely important.
And so what did this year's data, well, it's 2022-23 data, but the data that came out last month, what did this data tell us about how GP partner and salaried GP income has changed over that year?
These latest figures are for the 2022-23 tax year, and they show that income before tax fell by 8.6% for GP partners in England compared with the previous year, and rose slightly for salaried GPs, which it was up 1.8%. But if you look at the real terms figures, so the figures that take inflation into account, and this is based on the CPI measure of inflation, then the picture's a lot worse. So real terms income before tax for GP partners in England dropped by 17% compared with the previous year. And for salaried GPs, it fell by 7.5%. When you consider that the BMA in England was calling for an 11% uplift for the current financial year, in the context of these figures, that starts to look pretty reasonable. One thing we know about the factors behind that really large fall in income for GP partners is that 2022-23 was the year in which income from COVID vaccinations largely dropped out of the picture for general practice. So in each of the two previous financial years, GP income was effectively artificially inflated by practices taking on this huge additional amount of work involved in delivering hundreds of millions of COVID jabs. But with that income falling away in 2022-23, GP Partners' income is basically back where it was in real terms in 2019-20, and it's actually well below the level it was at a decade before that in real terms. So COVID income has masked the true picture of GP income for a couple of years, and the veil has sort of now been lifted again.
Yeah, the figures also show that expenses for practices rose quite significantly during that period as well, don't they?
They do. Just to explain what this is about, essentially the way income for GP Partners works is that practices receive funding through various income streams, the global sum payment based on their practice population, pay for hitting QOF targets, and from locally agreed contracts for extra services. And then once practices have covered all their costs for staffing, premises, heating bills, and so on, whatever is left is the partner's income. So the relationship between the gross income practices receive and expenses is really important because it determines what partners are going to take home as pay. So in 2022-23, expenses accounted for 71.7% of gross income. That's up 3.5 percentage points from the previous year. And it's actually the highest recorded figure, certainly at any point in the last 20 years or so. Expenses have generally been rising over the past decade and more. But to put this figure in context, expenses as a proportion of gross income for practices now are up about 8 percentage points compared with a decade ago, and about 10 to 15 percentage points if you look back at sort of 20 years ago. So expenses now are consuming more of practice income than they did in the past by a fairly substantial amount. And in terms of why there was such a big rise in expenses versus income in 2022-23, though, it looks like this is the result of a drop-off in COVID income, which has come at the same time as cost of living pressures starting to have an impact. And that has meant practices needing to pay more to retain staff. And as we touched on before, the bills for heating and lighting and so on going up.
Obviously, these figures are still from well over a year ago. There's a general consensus that things have probably got even worse since 2022-23, isn't there?
That's right. Accountants we've spoken to say that GP income is likely to have dropped again in the figures for the following financial year in 2023-24. Basically, that's as a result of some of the same factors again. 2023-24 was the final year of the 5-year GP contract, and that meant practices were still largely locked into fixed uplifts. There was some additional money paid to practices to help them offer staff a 6% pay increase in that financial year, but we know that for most practices, the uplift they received didn't cover the cost of that pay increase. So if they paid it, they made a loss. Meanwhile, in that year, the minimum wage went up by around 10%, and it has again this year. So practices are likely to have faced staff cost increases well above the rise in their overall income. And that's along with high costs for other things, heating, lighting, and so on, as we've talked about.
The data also has figures for the other 3 UK nations. What did it find out about what was going on in Wales, Scotland, and Northern Ireland? Is the picture any different there?
Looking at the other UK nations, average income for partners in Scotland and Wales was broadly unchanged in cash terms in 2022-23 compared with the previous financial year, but it fell by 9% and 10% respectively in real terms. In Northern Ireland, average partner income fell by 5.8% in cash terms and by 14% in real terms. What that reflects, I think, is in terms of why Northern Ireland fared so much worse than Scotland or Wales, is that the financial year we're looking at represents a period in which the power-sharing government was suspended. So there are real difficulties in agreeing funding uplifts for general practice, and that's come through here in the shape of big drops in income for partners. When it comes to salary GP income rose across Scotland, Wales and Northern Ireland in cash terms marginally, but it dropped everywhere in real terms by between about 2 and 7%.
You mentioned earlier that the Doctors and Dentists Review Body, that looks at this data as part of the process of making recommendations on GP pay. Obviously, it didn't see this latest data when it made the recommendations of a 6% uplift for partners, salary GPs and practice staff this year. So it obviously has to use quite out-of-date information when it makes its recommendations. This year's report did acknowledge that, didn't it?
Yeah, as you said, the DDRB looks at this data on earnings and expenses as part of the evidence it considers to make recommendations on GP funding and pay. I mentioned earlier these figures come from tax returns, and that means they take a while to become available because tax returns are filed well after the tax year ends, and then it takes time for HMRC to collate the information from them. The latest figures the DDRB had when it drew up recommendations for the current financial year, so we're talking about recommendations for 2024-25, which were published at the end of July. The most recent information the DDRB had were earnings and expenses data from 2021-22. So there's a sort of black hole where 2 financial years have passed but aren't considered as evidence for this year's DDRB advice. Accountants have criticised the DDRB for failing to consider more recent information. And the argument they make is that even though the DDRB may not have had access to figures from tax returns to this earnings and expenses data on more recent years, there's actually plenty of other evidence about what's happening to practice income that could be factored in. And as you said, the DDRB acknowledged some of this in its report for this year. It said that practices had consistently raised the issue of high increases in expenses over the past 2 years, outstripping increases in funding. They also recognised that COVID income would have largely fallen out of the picture by 2022-23, and we now know that's exactly what happened. So accountants say the big drop in GP income we've seen in these figures for 2022-23 was absolutely predictable, and that it should have been factored into the review body's advice in some way.
The BMA also really recognised that, didn't it? I mean, they conducted that massive survey and they were asking practice managers to provide quite detailed information from practice accounts so that they could submit more up-to-date evidence about exactly what was going on in income for practices to be considered as part of the evidence for this year. But how much that was actually taken into account is a bit debatable. So let's come on to the contract uplift for this year. The government has accepted that recommendation. We talked about it on the podcast last month, that GP partners, salaried GPs and other practice staff should receive a 6% pay increase this year. Like I said, we talked about that last month, but the statement of financial entitlements has actually been updated in the last week. Do we know anything more about how the uplift is going to be applied to the GP contract?
Yeah, we do. So the government has confirmed that the way it plans to deliver the DDRB advice is to increase global sum payments per weighted patient for GP practices by 7.4%. The government says that this uplift is intended to deliver a 6% pay increase for all employed staff in practices, so that's salaried GPs and other staff, as well as for partners. And the updated SFE, the Statement of Financial Entitlements, says global sum payments per weighted patient for GP practices will rise to £112.50 for 2024-25. So that's £7.77 above the level of funding that practices received in the previous financial year. The government has said that this is a £311 million investment on top of the previous uplift that was awarded from the start of this financial year under the previous government. And that was the uplift that basically tipped the balance for practices towards collective action, or to having the ballot on collective action. Alongside the global sum uplift, the SFE also confirms that various other elements of pay, things like locum reimbursement, maternity cover, and so on, will go up by the recommended 6% as well.
So what's the general feeling about what this uplift will mean for GP partner pay in particular? I think we said last month it was very unlikely GP partners would see a 6% increase based on this uplift, because we knew some of the details of this when we spoke about this last month. But we've seen a few more estimates from accountants about what it could actually mean for GP partners since then, haven't we?
So, and I mentioned a minute ago that the government insists this uplift is intended to deliver a 6% pay increase for all GPs, including partners. But the consensus is that it won't come close to doing that. What it will do is give practices enough money to cover the cost of a 6% pay uplift for employed staff. So that's an improvement compared with last year, when practices were told to pay 6% but not given the money to do it. But for this year, what will be left over after practices deliver the pay increase is unlikely to provide a 6% pay increase for the vast majority of GP partners. One accountant I spoke to said that based on an analysis of practices he works with, about half of partners will see their pay increase by 3% or less as a result of this uplift that the government is implementing. So in reality, the 6% rise for partners at least looks unlikely to materialise at most practices. Some of that is to do with the fact that this uplift is being applied as an uplift to the global sum. And in fact, GP practices, as we mentioned, have income from other sources. And because those sources are not increasing, and we know that, for example, local enhanced services now account for more income for GP practices than even the QOF does. And because those sorts of income streams are not increasing in the way that the global sum is being increased, and because there's big variation between practices and regionally in terms of how much income people get from those different income streams, delivering a 6% uplift for partners isn't straightforward. And basically, this uplift to the global sum is just not enough to do that everywhere.
Yeah, and I mean, based on what we said earlier, it comes after a couple of years of quite significant falling income as well. So it's not a great picture for partners, is it? Moving on, something else we've covered on GP Online over the past couple of weeks was a report by the Tony Blair Institute for Global Change, a think tank set up by the former Labour Prime Minister, on AI and the NHS. Earlier this year, the Institute published a report on how to harness data for health, and this latest report is advocating a digital health record to help drive improvements and ensure the NHS can make the most of artificial intelligence in the future. The report also said so-called AI doctors could help support decisions about care. So, Nick, what exactly was the report calling for?
So I think maybe the most striking bit of this report was what it had to say about this digital overhaul of the health service. GPs are currently the sole data controllers of all the information in patient records. They decide why and how all that personal data should be processed. But the Blair Institute said that government should take on joint responsibility for that role, become a co-data controller, as part of a move that would ultimately lead to the creation of AI doctors to support decisions about patient care. The report talks about creating a single digital health record for every patient in England within one term of government. And it says these new records would become the single source of truth for every citizen's personal health data, so some high-flown language, and that they would replace the current GP record as the integrator of health information. And the idea is that these records would incorporate patient data from all NHS providers, so hospitals, GP practices, anything else, as well as from private or third sector organisations, and even from wearable devices, so presumably data from smartwatches and phones and so on. And then the idea is to invest to build what it called a national AI-powered health analytics platform to inform decisions by both patients and doctors. And this is the part that the report says would ultimately evolve into an AI doctor.
The report also had some quite radical recommendations around primary care contracts, didn't it?
Yeah, it did. So the report talks about creating a new contracting mechanism for primary care. It said this should be outcomes-based and built around populations of 250,000 patients, but interestingly, not necessarily populations around specific geographical areas. So this could be populations built around multiple locations that aren't necessarily neighbouring. And the idea was that this could give patients more choice between providers. The report suggests this idea isn't necessarily about something that would replace the GP contract, though. It talks about this potentially becoming a voluntary contract that operates in parallel with the existing GMS contract. And it talks about having an incentive scheme built into it that could drive the shift over time of funding from secondary to primary care. So that's something that might appeal as a general theme to general practice. So ultimately, though, what is this? It looks like a potential alternative vision for the PCN DES, potentially, I would say. It's also worth bearing in mind that this comes as NHS England is pressing ahead with pilots of new models of general practice. So this could feed into the thinking around the evolution of at-scale general practice in that sort of way too.
Part of the reason this is all quite interesting for us to talk about is that because this is Tony Blair's think tank, it potentially has quite a lot of influence with the current government, doesn't it? The ideas it's putting forward and the types of issues the Tony Blair Institute looks at are likely to be quite reflective of the issues this new Labour government is interested in or looking for solutions on, isn't it?
Yeah, obviously reports like this to some extent come out all the time. Someone or other is always coming up with a bright idea about how the NHS could be improved with technology or in some other way. But as you said, this think tank is understood to have significant influence within the current government. Labour leader Keir Starmer was said to be talking regularly to Tony Blair before the general election, and the Institute has seconded a bunch of advisors into the Labour leadership's team, reportedly. There were also some reports that the influence of this think tank was likely to grow post-election, if anything, rather than diminish. We also know that the government has talked about technology and AI being a big part of its plans to improve public services. So all of that is very much aligned with what the report seems to be talking about. So this might well be an area to watch.
You're right with that, because the government generally and Wes Streeting are obviously going to be really keen to try and make the most of technology to help improve things in the NHS. The previous government was also really heavily invested in seeing how AI could save time and increase productivity. And I think it's quite likely we'll see a push on that to continue under this new government. During the election campaign, I went to an event where Wes Streeting was speaking, and he was talking about exactly this. He was talking about how important it was for data to be shared across the NHS, providing that patient information is secure and it's being used ethically. But he was talking about how patients are often surprised that their data isn't accessible in different parts of the NHS, how frustrating it can be for people to have to constantly repeat information. So a lot of this is the type of thing that was covered in this report, this kind of idea of a digital health record. So I think that's definitely the sort of thing that Wes Streeting would kind of be behind. One thing, while we were looking at this, the Tony Blair Institute also put a report out at the end of last year called Moving from Cure to Prevention Could Save the NHS Billions, which is actually a really interesting report that looks at how we can reduce the burden of chronic diseases by placing a greater focus on prevention. And again, that's something we've seen Wes Streeting talk about a lot, and it was a real focus in Labour's election manifesto, this emphasis on prevention rather than cure. That report, the Tony Blair report on prevention, was proposing a new nationwide preventive health programme with an emphasis on ramping up screening, vaccinations and other preventive treatments, including wearables, like you mentioned there, and really trying to roll out new innovations on prevention as they become available, with some of this technology linked directly into this new digital patient record that you've just been talking about. There's apparently going to be another report on that coming out later this year. So I think you're right, how technology and new innovations, in particular AI, can help in the delivery of public services, including healthcare. It's a big area of interest for the Tony Blair Institute, and I think it's obviously an area that this government is going to be really keen to look at going forwards as well. I mean, this is a government that's been clear it wants to deliver improved public services, but it's also been very clear that it's going to have to do that within very constrained budgets. So I think ministers are really going to be hoping that AI is what might help them to do that. So I expect we'll be discussing some of these topics quite a lot in the months and years ahead. What did GPs think about all of this? There was fairly negative response to the idea of AI doctors, wasn't there? But was there anything in the report that GPs welcomed?
The report actually called for the RCGP to be brought in as part of a group of organisations that could help develop AI-driven health analytics for the NHS. And the college said it would actually welcome the chance to be involved with that. But what the college also said was that AI doctors could never replace a qualified GP. I mean, I hope that's not news to the government in terms of its plans to make savings. But anyway, the college definitely sees a role for AI to support general practice and thinks it could help to reduce the bureaucracy and administrative burden on practices. But the point they're making, that this just isn't something you can consider as an alternative to increasing numbers of fully qualified GPs in the workforce, for example. There's a little bit of an echo there, now that I think of it, the whole debate around physician associates, to be fair. One GP on Twitter said the idea of AI doctors was dreadful, and he basically called out the report for suggesting that instead of training more GPs, the NHS could just bring in AI chatbots. But GPs are really worried about the idea of losing control, too, of patient data, this idea of losing their role as the sole data controller. So the argument around this has always been that control of that data and the confidentiality of that data is a really fundamental part of the relationship between GPs and patients. Patients feel free to share information with their GP because they're confident it's not going to be shared anywhere else. And there's a long-standing tension between that concept and the idea of using data at scale to drive healthcare improvement, or with sharing data across NHS providers to improve patient care. And with the debate around a potential role for AI, that tension basically seems to have shifted up a notch.
I think we're going to see a lot of discussions about this and about how data, and in particular patient data at the general practice level, how that's used more widely. I think that's going to become a big issue over the next months and years, definitely. Next up, last week, the High Court ruled that current limits on resits for RCGP exams for some GP registrars with a disability were irrational. This was following legal action by the BMA on behalf of a GP registrar. Nick, what exactly was this case about?
This started last year when the BMA launched legal action to challenge a rule about resits for exams that GP registrars take. They're basically the final step towards becoming a fully qualified GP. And there's a limit on the number of times a doctor can resit each of the 3 assessment tests to become a fully qualified GP. Basically, you can have 4 attempts, and if you don't pass within those 4 attempts, then that's it. But the legal challenge here is about how that rule was applied when a doctor is diagnosed with a disability or neurodiversity after using some of their exam attempts. The RCGP stance has been that it would allow only 4 attempts at each of those tests, even if a candidate finds out after sitting a test that they have a disability which, if known at the time, would have entitled them to reasonable adjustments, including additional time in an exam, for example. And a High Court judge has now ruled that this policy is irrational and that the college was wrong to say that it couldn't disregard exam attempts that took place before a later diagnosis like this.
So what are the implications of this going forwards for other GP registrars?
The BMA said it would pave the way for disabled GP registrars to receive much fairer treatment over examinations. Basically, it means that if they attempt these GP exams and struggle and then are diagnosed with a condition that means they should have had extra time or support in the exams that they've already taken, they can be allowed further resits. So it's a big shift, and it could be a lifeline for doctors who've been caught up in this.
What's the RCGP had to say about all of this?
For its part, the college has said that the judgment was complex and argued that it related only to the college's policy for the applied knowledge test element of GP exams rather than to the MRCGP exam as a whole. It also pointed out that the judge ruled that the college hadn't discriminated or breached the public sector equality duty, and it said that it would make a further statement on next steps, presumably about how this affects the way its rules apply in future, as soon as possible.
So I'm joined now by our senior news reporter, Kimberley Hackett, for our regular good news slot.
Hi, everyone.
Kimberley, what's this week's good news story?
Yeah, so I had a really interesting chat with 2 GP partners from the Wirral who told me about their newly formed smaller PCN that they believe will help them deliver more preventative and patient-focused care. What's happened is that 3 practices that are geographically close to each other decided to leave a larger PCN of 120,000 patients to form a new one covering 30,000 patients.
Yeah, that's quite interesting, isn't it? That's because it's almost like going from the biggest size PCN you can get to one of the smallest size PCNs you can get. So this is a bit different from the usual good news stories we have on the podcast. So why exactly is this a good news story, and why have we picked it this week to look at?
Yeah, so we've chosen this as our good news story because the GPs I spoke with were really enthusiastic about their big plans to take services into local neighbourhoods. Now, these won't only be GP services, they will also include other healthcare professionals and third sector organisations. Now, one of their ideas is around employing health coaches and joining forces with charities to promote anxiety management in schools. The doctors said it is an area that needs to be looked at due to the hangover from COVID and the lockdowns. And another really interesting idea they had is around teaming up with substance abuse clinics. The doctors have always referred into these organisations, but they want to find a way for substance abuse services to meet with people before they become patients. Now, the PCN is newly formed and a lot of this is in the planning stages, but the practices really do believe that by tailoring its care towards the local population, it will really help with health prevention.
It's a really interesting idea, isn't it? It would be really interesting to see actually what happens with that PCN and whether they feel they've actually made more progress on those things like health prevention as a smaller unit rather than that bigger 120,000 network they were part of before. So it's definitely something we'll be keeping an eye on. Well, that's it for this week. Thanks so much to Nick and Kimberley, and thanks for listening. I'll be back next week. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice and access a lot of other resources on our website at GPonline.com.